cancers that plague men, and statistics show that men have a 1 out of 2 chance of being diagnosed with cancer, as opposed to women who have a 1 out of 3 chance of being diagnosed with cancers. So tonight we are going to discuss about the cancers that are unique to men by maybe how they were made as opposed to women. And my guest tonight is Dr. Shen. Welcome to the show, Dr. Shen. It's a pleasure to have you.
Yeah.
Yes.
Pleasure to be here today to talk on the cancers that are unique to men.
Yes.
As you mentioned, November being the prostate cancer awareness month, and it would be a nice way to create awareness on prostate cancer.
Thank you so much. Now, before we even go to the discussions of our area of interest tonight, right? It's good that we know who you are. Who is Dr. Shen?
Okay, so I'm Dr. Shen Ali. I come from Mombasa. I'm a clinical oncologist, specializing in treating solid tumors, cancers like cancers of the breast, prostate, colon cancer, lung cancer. I undertook my studies, my bachelor's in medicine at the University of Nairobi, completed in 2013. Thereafter, I specialized in oncology, clinical oncology at the Alexandria University. I have 3 years post-specialization, 3 years of experience. And we deal with all types of solid tumors.
Wow, thank you so much. And right now we are here at the Jalaram Medical Services, the medical center. And we will talk a bit about what is offered here later in our session. But as you said, you deal with solid tumors. Maybe you can mention to us some of the common cancers in men, and then we can look at those that are unique to men only.
So the most common cancers that affect men, we have number 1, prostate cancer, which is very common, especially in our local population. Lung cancer also is very common in men. And then we also have cancers affecting the gastrointestinal tract, like esophageal cancer or colorectal cancers, which are very common also in our part of the country.
Now, if we can narrow that down to those now that are unique to men by what we call anatomy.
So, in men, the lower genitourinary tract, we have prostate cancer. We also have bladder cancer and testicular cancer. So those are somehow, bladder cancer can also affect females, but it's more common in males. And testicular cancer definitely only in men. Yeah.
Maybe in another world there are women who have the testes. Yeah, so prostate cancer, bladder cancer, and testicular cancer. And I think that's what we will want to dwell our discussion for this session. Starting with the prostate cancer. Let's start with prostate. You know, we hear about the prostate so much, but where is the prostate located in the human body, and what is the function?
Okay, so the prostate is a small gland which is around the size of a golf ball, which is located, just sits below the bladder, urinary bladder, which collects urine from the kidneys. So the main function of the prostate gland is to produce fluid, which forms part of the semen, which usually nourishes and protects the sperms whilst they're in the female genital tract. So that's the main function of the prostate gland, to produce the fluid and to help the sperms.
Any other function apart from that you know is of crucial to the... Does the prostate hold urine for us? Is it involved?
No.
It is not. Because, you know, the reason we are asking, maybe we will talk about that in how problems of the prostate present is traditionally or locally, in the layman language, somebody will say have a problem with passing urine. I have a problem with the prostate. Yeah.
The only issue is because from the bladder we have the urethra which passes through the prostate gland, and it's just sitting below the prostate. The prostate is just sitting below the bladder. So any problems coming up about the prostate can cause some obstruction in the urine flow. Yeah. So most people will then associate prostate issues with urinary problems. Yeah.
Now, so prostate and then prostate cancer. So what are some of the risks or habits, exposures that can make somebody to start developing something that is going towards the direction of prostate
Usually
cancer?
prostate cancer is a very slow growing type of cancer, and one of the main risk factor is age. As a man advances in age, usually above the age of 55 or 60, that's when the chances of getting prostate cancer are quite higher. The other factor that could predispose men to prostate cancer is family history. If someone has a strong family history, if the father or a sibling, the brother has had prostate cancer, then the likely chance of that individual having prostate cancer is higher. In terms of race, prostate cancer is very common in our African population as compared to the Caucasians or the Asian population. So we see quite a lot of prostate cancer in our population. Other risk factors which are not very directly linked, too much consumption of red meat has shown some association with increasing the risk of getting prostate cancer. So basically those are the main factors that one would consider.
Do you mind just expounding, because this, many times when you speak about the direct issues like family history, age, it's easy to say, okay, well, my family is like that. But when you come to something that people do daily, like, I don't know if smoking is part of it.
Smoking, not really. There's not been a direct link. Maybe it could be having a small impact on increasing your risk, but no, not a direct risk for causing it.
All right. The same to meat, like somebody will say and will ask you, like, how does meat relate to the prostate cancer? Yeah.
It's mainly related to, from my understanding, maybe the transit time in the colon, which can expose the body to toxins from the meat, and that somehow might be linked to causing cancer in the body. Not only prostate cancer, but red meat also somehow has been linked to causing colorectal cancer as well.
The other things that somebody might ask, like the issue of men, early sex, multiple sex, is it related to whether somebody developed prostate cancer or not?
It's controversial and debatable. There are some studies which have shown that frequent ejaculation can reduce your risk of getting prostate cancer.
Frequent ejaculation.
Yeah, so it somehow can be considered as a protective factor for developing prostate cancer. But in terms of increasing your risk for getting prostate cancer, it's not well established yet.
It is not well established. So you cannot peddle that as
No, not really. But a few studies that I've come across which have shown that the more men ejaculates frequently, as in has sexual activity, then that reduces the person's chance of getting prostate cancer. But still a lot of more studies need to be done to find the exact relationship between having sexual activity and prostate cancer.
Reviewing some materials, there was something mentioned also about weight and prostate cancer. Like men who are obese can be at risk of developing prostate cancer as opposed to...
That's true. Obesity is a risk factor for various cancer. It can also impact one's risk on getting prostate cancer as well. But it's not one of the main risk factors, but it can also impact on increasing one's risk of getting prostate cancer. Probably due to the imbalances in the hormone levels, probably that could be one factor.
All right. The last bit about the risk factors. We know about the hormone called testosterone, right?
Yes. Male hormone.
Male hormone. So when you look at testosterone and the predominantly female hormone estrogen, how do they two relate in terms of prostate cancer?
Testosterone as a hormone does not increase or predispose someone to develop prostate cancer, but somehow we use certain medications to block the male hormones to treat prostate cancer, because usually the male hormones usually feed or stimulate the prostate gland to produce the seminal fluid. So in that way, somehow we are able to treat the prostate cancer. So the main marker that we use is called PSA, which is called prostate specific antigen, and that's a marker that we use to usually monitor patients who are on treatment for prostate cancer. It can be also used as a screening tool, but it's not so effective as a screening test for patients who are at risk of developing prostate cancer, because there are certain other factors that can cause a high PSA level and can give a false positive.
All right, so we are going to take a break, and when we are back, we will pick up the discussion and we'll look at the signs or symptoms that you might experience to suspect prostate cancer. So stay tuned. Welcome back. You are watching Body Garage, the Art of Wellbeing. I'm your host, Dr. Chepsi, and my guest is Dr. Shen. And Dr. Shen is a clinical oncologist. If you are watching the show from right now, we are talking about prostate cancer. So what are some of the symptoms, or in simple language, things that somebody experiences in their body that can make somebody to suspect they might be having a problem with the prostate?
So since the prostate gland is closely situated in the lower urinary tract, so the symptoms are usually related to passing urine. So what we call obstructive symptoms. A person might develop problems with passing urine. So one very common symptom is if a person is feeling like he's always feeling like going to the loo for a short call, that we call frequency. Or if a person has to wake up several times in the night to go and relieve himself in the loo for a short call, that's another common symptom. Though they are also related to other diseases, but it also can cause a red sign to alert someone that he could be having a problem with the prostate gland. Other symptoms like a patient cannot or a person cannot control his urine, or a person rushes to the toilet to go relieve himself, but before even reaching the loo, the urine has already leaked out. So those are some of the common symptoms. Another common symptom is if a patient sees any blood spots in the urine, that could also cause an alarm and could be related to problems with the prostate gland. Also sometimes very not so common, but patients can experience some pain around the pelvic area, or sometimes even pain when passing urine. Yeah. So those are the common symptoms someone can experience when they're having problems with the prostate gland. There's another entity which we call benign prostatic hyperplasia, which is a condition where the prostate gland enlarges, which is normal as a person ages from above 40 years and beyond. The prostate gland usually enlarges, and that can cause similar symptoms to prostate cancer.
How do we differentiate? At what stage will somebody differentiate between those, the one is called benign, like it's not cancer, and the actual cancer?
So the only
considering they have the same symptoms.
So the only way to differentiate someone having a benign prostatic hyperplasia and someone having prostate cancer is, number one, to see a medical doctor. The doctor will go through the patient and examine, and usually the doctor is supposed to do a digital rectal exam to palpate and feel the prostate gland. If he finds that it's having abnormal growths or some nodular texture, then that would cause alarm that maybe it could be prostate cancer. And the doctor will order further tests to confirm whether the patient is having a benign lesion or it's a prostate cancer. Yeah, so that's the main way to differentiate the two.
So somebody at home experiencing this symptom themselves, they cannot differentiate, so they need to get checked?
Yeah, they need to be checked at the hospital by a doctor and run several tests and scans to determine whether it's normal benign prostatic hyperplasia or it could be prostate cancer.
Yeah, sure. Now, off the camera we were talking, and one of the challenges with the prostate cancer and generally men is that they present to the hospital when the disease is already quite advanced. But we know that prostate cancer is one of the most treatable cancer, is it?
Yeah, that's right. Treatment for prostate cancer is very much advanced, and patients can be managed and treated well, even in the advanced stages. Even if it's in stage 4, patient can be easily treated and managed. So it's crucial for patients to detect it quite early, so that the chances of getting it treated are much higher.
Yeah, yeah. All right. So my question was like something that is treatable, but you're getting most of these cases at advanced stage. What are the challenges from your experience interacting with your patients? Like, what is making this kind of men present to the hospital late? Is it because they assume the symptoms? Is it cultural problems? Is it financial problems?
So in our setting in Kenya, majority of our patients, not only for prostate cancer, but in terms of other cancers, usually they tend to present at a very late stage. They usually come to the hospital when the cancer is advanced or has started spreading to other parts of the body. There are several factors that can contribute to people presenting late to the hospital. One of the factors is stigma. There's still a lot of stigma related to cancer, or I think could be also cultural. People tend to avoid coming to the hospital until it's very too late. One challenge with cancer is sometimes the symptoms may start coming up at a later stage. Usually at the beginning the patient might not have any symptoms, so that's one challenge. The other factors could be socio-cultural factors, and also probably we don't have very good screening programs that have been effected by the country to pick up cancers very early.
All right. Now let's just continue from where you mentioned about the screening programs. When should I, as a man, start considering that I must be screened for prostate cancer? When should I start? How frequently? What are the screening options that I might need to be undergoing?
Okay, so screening usually is advised for men above the age of, usually above 50, 55 years of age. That's when they can start undergoing screening for prostate cancer. One of the main ways to identify prostate cancer is, like I mentioned before, is seeing a doctor and performing a digital rectal exam. So to actually feel the prostate gland and determine whether it has got any abnormal growth or not. That's one way. Another important tool is the blood test called PSA, prostate specific antigen blood test. PSA is a marker, it's a substance that's secreted by the prostate gland, and usually when there are problems within the prostate gland, the PSA is high. Especially in cancer, it can go as high as up to 50, above 100 and above 200. There are other conditions which can also cause a high PSA, so those should not be confused with prostate cancer as well. Other tools which can be used, like prostate ultrasound, can also determine if there are any abnormal lesions. Ultimately, if someone is caught up and found to have a suspicious lesion, the only way to diagnose it is to take a small specimen from the prostate gland, which we call as a biopsy, which is then examined under the microscope to determine whether it's really a prostate cancer or a benign lesion.
So let's talk about the first two that you mentioned, the digital rectal examination and the PSA. So how frequently should somebody be doing that? Let's say they've started at 40. Should I do it every 6 months? Should I do every 1 year or 5 years?
So screening usually is recommended once a year. But patients with high risk, like for example, if a person whose father had prostate cancer or the brother sibling had prostate cancer, then that one would be at a high risk. So that one would be advised to do it once a year, so that it can be caught up early and treated effectively. Yeah.
The same to the PSA?
Yeah, PSA similarly can be done once a year because it's not such a costly test, and it can be done simply by drawing out some blood and getting the results.
All right, I see. Now, let's go to the last bit about this, about the treatment. You mentioned that prostate cancer is one of the most treatable cancers. And I assume also quite some significant good outcomes, right? Yeah. So what are the treatment options for the prostate cancer?
So we have several treatment options for patients with prostate cancer. And there's been a lot of changes in the treatment of prostate cancer over the past 20 years. So one of the main treatments, if it's picked up early, is surgery. Surgery, now we also have very advanced techniques such as robotic surgery, which can be used to remove out the tumor from the body. That's one part of the treatment. Other treatments which are quite effective are hormonal therapy, which is quite an effective treatment for prostate cancer. We have several types of hormonal treatment as well. Chemotherapy also is another arm of treatment for prostate cancer. We also now have targeted therapies. We have immunotherapy, which is also now gaining a lot of importance in the field of cancer in terms of treating cancer. So those are the main treatments for
options. Okay.
for prostate cancer. It will depend. Usually we combine several of these treatments to effectively provide the best for the patient.
Yeah.
Another important one is, which I forgot to mention, is radiotherapy.
Yeah.
Radiotherapy also is very effective in treating prostate cancer as well.
All right. As we wind up on the prostate cancer, do you have any particular case, patient that you've taken care of and the results were quite remarkable? Of course, not mentioning the name, but just the story, briefly.
Yeah, we've treated several patients with prostate cancers.
Yeah.
Some even with stage 4, whom we put on radiotherapy and hormonal therapy, and they are doing perfectly well several years after being diagnosed and living normal lives. Yeah.
All right. That's great. Now, because of time, let's take a break, and when we are back, we are going to switch our discussion to testicular cancer as we are coming to the close of the show. We'll see you after the break. Welcome back. You're watching Body Garage, the Art of Wellbeing. And as usual, my name is Dr. Chepsi. I'm your host. So we have talked about prostate cancer. Now we are going to switch and talk about the bladder cancer a bit as we are almost coming to the close of the show. Now bladder cancer, Dr. Shen, as you said, is a cancer that is not really unique to men because even women have the urinary bladder, right?
Yeah, that's right.
But it's more common in men, right?
Yeah.
So let's speak right there. Like, what will make this to be more common in men? Is it because of habits? Is it because of the structure of the male urinary system?
The research has not really picked out why men are more predisposed to bladder cancer. Maybe I would feel this is not well documented, but just from my mind, probably because the men are able to probably store more urine, or maybe that could be a reason. I'm not so sure.
So holding the urine for longer.
For longer, maybe.
Okay.
Then expose the bladder wall to more of toxins. That could be maybe a postulate or
Maybe it's an area of research now for the people.
I've not come across the real reason why men are more affected than females. Yeah.
All right. So what are some of the other risks that bring about the development of the bladder cancer?
So one of the main major risk factors for developing bladder cancer is exposure to tobacco. So smoking, cigarette smoking usually increases one's risk up to 3 times to developing bladder cancer. Mainly by smoking, the toxins are filtered into the blood and go into the urine. And when they stay for a long time in the bladder, that can predispose the person from getting bladder cancer. Maybe that could also give the reason why men are more affected, because usually I tend to feel men smoke more. So that's one main reason. The other main risk factor is chemical exposure. Usually certain industries like rubber industries, textile industries expose the workers to certain chemicals like amines, which then can contribute to developing bladder cancer. Other risk factors like, again, family history or genetic predisposition, or if someone has a constant chronic inflammation of the urinary bladder, that can also predispose the person to develop bladder cancer.
Getting frequent urinary tract infections predisposed to...
Yeah, that one also is another important factor, because it will lead to chronic inflammation of the bladder wall, and that can predispose the person to get bladder cancer. But it's not a main risk factor. So if a patient is constantly getting urine infections, then that can lead to some inflammation in the bladder wall and can predispose the person to bladder cancer.
Now the other culprit that is almost associated with every other cancer, alcohol. Will it be associated with, you mentioned about smoking, what about alcohol?
Alcohol can also be a predisposing, can be a risk factor as well, but not as strong as smoking. Yeah.
So what are some of the symptoms that somebody might be experiencing that can point towards bladder cancer? For prostate, we talked about the frequent urination and the related. What of the bladder cancer? So
for bladder cancer, the red flag that would tell someone that he could be having bladder cancer is if a patient develops or a person develops blood in the urine, painless, frank blood in the urine, then that one raises a red flag that the person could be suffering from bladder cancer.
Blood in urine.
Over majority of the times, in about above 80% of the times, if a person sees blood in the urine, gross or frank blood in the urine, then that could point out to tell that one should be cautious that could be bladder cancer.
All right.
Though there could be other causes of having blood in the urine, but for bladder cancer, that is one of the main symptoms that one could have. The other symptoms could be like going to urinate frequently, having some pain in the lower abdomen or in the pelvis. Sometimes some frequent infections. Also, sometimes the person can develop low blood level, anemia, because of the loss of the blood. Yeah. So those are some of the common symptoms that a person could face.
What I'm getting is that it's almost, the symptoms could almost be like that for prostate.
Yeah, since they are almost close by structures and they are part of the lower urinary tract system. So the symptoms are more like overlapping each other. But for bladder cancer, if you see blood in the urine, then that's more of bladder cancer than prostate cancer. Prostate cancer is very rarely causing any blood in the urine, but it can also be a symptom for prostate cancer.
All right. Now, for the urinary bladder cancer, do we have screening mechanisms for it, or that one just shows up?
Yeah, there are screening tools, but screening, since bladder cancer is not so very common, so screening is not very well established like in prostate cancer. But the tools that can be used, since we said that blood in urine is one of the most common symptoms, so a simple test is by just doing a normal urine test, just to examine whether the person has any blood, whether it's microscopic blood or frank blood in the urine. That one can lead to, or can point out that a person could be having bladder cancer. So it can be used as a cost-effective tool to screen patients from bladder cancer. Other ways to determine for screening could be a normal simple pelvic ultrasound, using an ultrasound to scan the bladder and see if there are any abnormal growths in the bladder. Another important tool is cystoscopy, putting a camera through the lower urinary tract and to examine the bladder wall and see if there are any abnormal growths in the bladder. So those are the common tools that can be used for screening, I suppose. Yeah.
And all this can happen within Kenya?
Yeah, all these investigations and test scans are all available in Kenya. Majority of the treatments as well for cancer, both prostate cancer, bladder cancer, or any other solid tumors, all are mostly available in Kenya. Yeah. So even we have some of the advanced treatment techniques in terms of radiotherapy, chemotherapy, the immunotherapies, targeted therapies, they are all available in Kenya. So we have many patients running towards other countries for seeking further treatment. Some are not warranted because most of the treatments are available here in Kenya.
All right. Now, just briefly about the treatment options for the bladder cancer. What will be the treatment look like? Are we going to remove the urinary bladder? Or there are other options that can still help these patients go on?
Yeah, so like you mentioned, removing the urinary bladder, that's quite an extensive surgery and also will impact on the quality of life of the patient. So we have other options for treating bladder cancer. One of the main ones is radiotherapy, which is use of high energy X-rays focused on the area where the person has cancer. So radiotherapy, usually we combine it with chemotherapy depending on the stage and other risk factors. So that's one of the effective ways of treating bladder cancer. We also have minimally invasive surgeries. So if it's an early stage bladder cancer, they can do a procedure called transurethral resection of the bladder tumor, where they just put a scope through the urethra and just resect out the growth.
Tumor part.
Yeah. So apart from surgery, radiotherapy, we have chemotherapy. We also now have immunotherapy, which is also a new form of treatment of cancer. Those are the main arms of treatment for.
Again, and they're all available in Kenya.
All available in Kenya.
We should minimize the part of traveling abroad for treatment. Yeah. All right. Now, having discussed about the prostate cancer, the bladder cancer, how is the politics around this? You know, of course, medical practice, you can't run away from politics. Yeah. By politics, I mean like policies about establishing clear guidelines when it comes to advocating, programs, screening programs, treatment programs, like where are we? If you can give us a landscape about maybe these two types of cancers that we've talked about.
So, as a country, in terms of screening, the uptake of screening, especially for prostate cancer and other types of cancer as well, is quite low in our country, based on various reasons. One is stigma around going to hospitals or around cancer itself, the socio-cultural reasons that are around us as well. I think we have come up with guidelines. There's Kenyan guidelines of treating various cancers. Yeah. But the only problem is the lack of screening. What needs to more be done is to create awareness on different cancers that are common in our population, especially for men, prostate cancer. The other important thing is to create maybe public-private partnerships on how to carry out screening programs or other programs, treatment programs for patients suffering from cancer.
All right. We're being notified our time is far much spent. Okay. We are doing this session at Jalaram Medical Services, okay, which is a center situated here in Parklands, right? Yeah. So maybe in brief, you can just speak to the people about the kind of services that you offer here.
Okay, so this center is Dr. Rasik Kantaria Jalaram Medical Services. It's a faith-based charitable institution. It's one of its kind medical center facility. It's been running now 2 to 3 years. Initially, it was a very small clinic, but then they've built this very nice center. It's a 6-storied building. It's a specialized outpatient facility, which is one of the biggest in East Africa. We don't have such a kind of facility in East Africa apart from this one. We offer various specialized services from the GP clinic. We have a very good, well-equipped laboratory. We have a radiology department which caters for majority of the crucial scans. We have the specialty clinics like cardiology, urology, orthopedics, diabetic clinic. Then we also have a very good oncology clinic, a very well established ophthalmology clinic as well. We also have a physiotherapy department. We also have a very good, well equipped endoscopy unit. So all this under one roof as day cases or as outpatient, and slowly growing.
And you mentioned that one of your key things is that you make services affordable to the people.
Compared to the other centers, this center, since it's a faith-based and charitable institution, so the charges are very minimal or reasonable compared to other facilities around the area.
All right, thank you so much, Dr. Shen.
It was a pleasure being here.
Yes.
We need to create more awareness and about prostate cancer and other cancers as well.
Thank you so much. Thank you for sharing your knowledge, your experience, and for educating the people. Yes. We can find you always here in the facility?
Yeah, our oncology department is on the 3rd floor, so that's where we run our clinics and give chemotherapy.
Sure. Thank you so much. Yes, we have come to the close of our discussion tonight. We have talked about prostate cancer and bladder cancer, and I trust that at least you have picked a thing or two, and you can keep checking on yourself. To all the men out there, your wellness and your health is also important.